I'm going to talk about 4 different things today.
Okay.
Each of which could take hours, but the first thing I want to talk about is the earthquakes in China, then Star Wars, then the safety net, and then the election. I think all of us looked at the photographs in the newspapers of the buildings in China that collapsed during and after the earthquake. One of the most stunning pictures was of a school completely fallen to the ground, while the buildings on either side of that school were still standing and intact, because the school building was apparently old and badly constructed. When it's easy for people in Marin to forget about earthquake problems, they have pretty much forgotten about the potential earthquake problems of Marin General Hospital. This news from China was a useful reminder that earthquakes do happen and that buildings that are not properly constructed can collapse. And we need to keep that in mind when people say, we don't want to use public funds to pay for bringing our hospital up to modern seismic standards, okay? Star Wars. George Lucas used to have, to present his Star Wars films, a large facility in the canal area of San Rafael, which is called, still called, but it's moved, Industrial Light and Magic. This was the largest single piece of property in the canal area of San Rafael. The County of Marin, to provide the health care and other social services that it provides to people, mostly low-income people or people who are suffering some sort of personal or family emergency. They thought, rather than renting offices in a variety of buildings within the county, they could consolidate all of those services on this large piece of property in the canal area that used to be George Lucas's technical headquarters. And they are proceeding very rapidly to make a comprehensive healthcare facility available in the canal. It's good because it's on a bus line. You can get there by public transportation.
Well, that makes a lot of sense.
It's an amazing change from having this office in Green Bay and that office in Novato and so forth. So that's progress. And by having them together, if your social worker finds that what you really have is a healthcare problem, you can go within the same complex to the new consolidated Marin Community Clinic in that what used to be Star Wars area. It's a huge and expensive move on the part of the county, but down the road it will make sense to have everything accessible. And it's one of those big expenditures that saves money over the next 30 years, but you have to do it. And when the property became available, when Star Wars moved to the Presidio,
did the county buy that property, or are they renting that property?
No, they bought it.
They bought it. Okay.
Safety net, which is related to Star Wars. The county, a year ago, set out a contract for the Aberth Consulting Company saying, what are the services that we are legally obliged to the people who depend on county services? And that was question A. They did the same thing in San Diego and various other places. It's a very well-respected healthcare consulting group. And so what services do we have to provide? What are the nonprofits and other groups that we have to work with in the county? And what is our budget for providing those services? And that report will be coming in to the Board of Supervisors sometime in June. And if anybody really cares about public health care services, they can watch the broadcast of the Board of Supervisors meeting. And we all work together here.
Yes.
And they can watch it either in person during the day, or they can watch it at their convenience. The biggest problem facing the county is if Marin General Hospital does not survive, if it cannot get through the transition and maintain enough of a core of services to serve the people on the welfare lists and on the safety net programs, then they are going to have to ship their people to other hospitals somewhere outside the county. Because if you're a private hospital, you have no contract with the county to provide these services, and you have no obligation. Private hospitals have to provide some charity care to be called nonprofit, but they don't have to provide it on the scale that Marin General has, because Marin General is a public hospital. Now, to go from that, there are safety net patients also in San Francisco, but in a miraculous effort to do the right thing, San Francisco has created its own, within the county, Health Care for All program. And they are making it work because they own the county hospital. The San Francisco taxpayers pay for county hospital. And so they have, I think, 6 different community clinics that refer into San Francisco County Hospital. And they are able to compel all employers of more than 20 people in the whole city of San Francisco to contribute to health care for their own employees. And so it's an interesting mixture of things.
It seems to be working for San Francisco.
But the problem is San Francisco is a single city-county jurisdiction.
That's right.
And we don't even need LAFCO in San Francisco. Finally.
And the last?
And the last.
Yes.
There will be an election in November for the Marin Healthcare District. What people need to be aware of is the district is functioning well. It is no longer a dysfunctional board. Reasonable people talk to each other. They've hired an excellent executive director. However, every 2 years, you have the potential for changing the direction of a board. The issue is, will there be some reasonable people who can talk to each other and deal with a very skilled executive director that they've hired to move forward, because there are dozens and dozens of big deadlines coming up. They have to design the building on that site by the end of this year. They have to have architect's plans to submit to the state. Going back to item 1, the earthquake seismic safety issue.
Is that election June or November?
November.
November. Okay.
Isn't 40% of the people in Marin Kaiser?
40% of the people in Marin currently belong to Kaiser, and Kaiser is growing. What's in it for them to support Marin General Hospital? Okay, there are 3 things that Kaiser patients and Kaiser families need to remember. If you want maternity care, it's available at Marin General. If you need psychiatric care, it's available only at Marin General. They have the only psychiatric beds. And there is one and one only trauma center. So we need a good board for that.
Right.